Indianapolis Colts quarterback Andrew Luck is retiring from the game at the age of 29. Luck cites years of injuries from the game as a reason for early retirement. In light of his announcement, we wondered how much of a toll does playing sports have on students and what does it mean for their future health? Lily Pesavento has been following this story. She joins me now in the studio. Lily, I understand you were actually able to talk to some sports medicine professionals today about this.
I was, and I absolutely wanted to get the input of head coaches just to see where their heads are at, especially with the safety of their student athletes. Yeah. After speaking with Terre Haute North Vigo High School's head football coach as well as an orthopedic surgeon, the answer is clear. Injuries happen to any athlete at any time, and some are minor and others may require a little more time spent off the field and on the bench. Dr. Keith Flack, an orthopedic surgeon from Union Medical Group, sees a variety of sports injuries and a variety of patients, but two sports stand out the most.
I would say obviously football. You're seeing a lot of injuries in football, but I would say female soccer, high school level, there's quite a bit of injuries to their knees.
Terre Haute North Vigo High School's head football coach, Chris Barrett, is constantly pushing players to condition year-round to build up strength. He says the stronger your muscles, the lower the risk of injury, such as concussion.
You could be doing everything right and still get one, but you can really limit the chances of that. Another way is like falling back on the strength and conditioning. The more you build your neck up and the stronger your neck is, the less chance you have of getting a concussion. Just that strength and that mass will help absorb that blow.
For players who do receive concussions on the field, they'll have to complete a return to play protocol before they can leave the bench.
Every student athlete takes what we call the impact test, which is a computer-based test that measures memory, timing, reaction time.
Concussions aren't the only major injuries. According to OrthoIndy.com, an orthopedic surgery center in Indianapolis, the most common injury for soccer players is a sprain or tear in the ACL. Treatment can include physical therapy and surgery, but once the player is back on the field, they may not be the same.
Now they're starting to look at more recent literature and studies on non-professional athletes and anterior cruciate ligament tears. And very, very few of them ever return back to the level of sport they were participating in before.
Not every injury requires surgery, but bringing in an orthopedic surgeon for advice when something looks or feels off could be the difference between playing the game and taking off for an entire season.
We found out that the athletes and that people do better sometimes with certain types of fractures and deformities with surgery than without. The old way of thinking is let's treat all these non-operatively, and that's not so much the case anymore.
Dr. Flack recommends parents bring their student athletes into the emergency room for any injury that involves a deformity or numbness of an extremity, such as a crooked knee or a locked joint. And in the case of concussions, if the athlete is presenting symptoms of nausea, headaches, memory loss, or lack of coordination.
I know I got my bell rung several times. Can't you tell?
Yeah. Oh, yeah. I was going to ask you about that.
Yeah, okay. Well, what does their future hold with these athletes who are injured?
Well, some of the biggest concerns really have to do with arthritis, and that's from all of the wear and tear on those joints. So that's the biggest thing that some student athletes are looking at.
All right.